Okay, everyone, it's a pleasure to be with you again tonight on our virtual town hall, Living with Lupus and COVID-19 in our community. Today is June 7th, and it's a pleasure to do this again. We have a special evening. We have Representative Kim Schofield that will join us to speak for most of tonight's session, but I'll start with about 10 to 15 minutes of general updates as I've been doing. As always, I'd like to thank the Lupus Foundation of America, Georgia chapter, and Terry Emond and all that she does. Please go visit the website and the COVID resources. She's constantly updating that. I'd also like to thank our other supporters, the Georgia Council on Lupus Education and Awareness, with Chris Reed as chair. Representative Kim Schofield is on it as well. And also the GOAL Research Project that's supported by Emory University Division of Rheumatology. So as I mentioned last week and the weeks before, COVID is here to stay. It's just going to keep marching around the globe. But we're still in the phase where there are places that are having large areas of uptake. And I think eventually it's going to settle out where every country basically is going to have pockets that flare up here and there, and we'll have to manage that and deal with things. But we're still, in parts of the world, there are some areas that are just really starting to grow quickly. And the big one these days is Brazil. And Brazil's numbers are quite scary, and they're even projected to meet the US figures in some regards fairly soon. And then other areas like India as well are creeping up. And you can see in terms of parts of the globe that are really having a lot of uptick in cases, or hotspots, if you will. It continues to now be the developing countries. We're talking Central and South America. I mentioned Brazil, but so many other countries around that area, big parts of Africa, the Middle East, and Southwest Asia. So it's going to be very interesting as things move forward. And you can also see Sweden is having an uptick as well, and we talked about them a few weeks ago. Right here in our home state, Georgia, you can see the numbers there. Honestly, some of the numbers are difficult to get by because the sources are at the state, and we've talked about some of the challenges in terms of how the state gets some of the numbers, or specifically the governor's office. But for whatever it is, the official numbers are trending such that at one point it was trending lower, but now it's pretty much stable, but it is not officially seen as going up dramatically. But it's very simplistic to think of even a place like Georgia as just one number. And Georgia, as you see here, in terms of hotspots, it depends. It depends on what area and at what time. If you look at the bluish numbers, those are areas that, at least in the last 2 weeks, the number of cases seem to be falling. The yellowish areas are the ones that are about the same. And the shades of ranging from orange to dark red are the ones that are really increasing. So in a sense, it's good to see most of Metro Atlanta having blue or falling. But if you look closely, you see Gwinnett being one of the rising areas. And it wasn't much earlier in the pandemic. In fact, it was one of the counties that were relatively spared. And I think this constant up and down, see where the cases spike, and it could be because of demonstrations or certain industries or certain functions that may have triggered a hotspot. That's what we're always going to be watching out for. It's kind of like a whack-a-mole game, if you remember those from the old days. And then you have areas of the rural counties that are continue to light up. You see LaGrange and near Columbus. Albany, Phoebe Putney, I heard at one point, had no cases of COVID in their hospitals after such an amazing journey. But you can see just right neighboring areas nearby, down to Valdosta, there are a lot of cases. So It's going to be this up and down, here and there, popping up there. You knock it out, it's going to pop up somewhere else until we have a definitive vaccine, and it's just going to be that way. Hydroxychloroquine or Plaquenil, this is just amazing. It's really like a soap opera. I talked to you a couple weeks ago, well, actually last week, talking about the week before that. So if you think about 2 weeks ago in terms of period of time, what was going on with Plaquenil? Last week, I talked to you about that week, and we talked about how the World Health Organization had temporarily halted studies of hydroxychloroquine because of a few things, but in large part, it was made after a medical journal, a prestigious one called The Lancet, published on how seriously ill COVID-19 patients who were treated with hydroxychloroquine and chloroquine were more likely to die or develop irregular heart rhythms. And because of what WHO did and some of the other studies, and that particular study in The Lancet, France, the country of France, halted the use of hydroxychloroquine in COVID because of WHO. And all of these things were sort of domino effects from one or two key studies, primarily that Lancet study. And then other things in the press, you can kind of sense this momentum against hydroxychloroquine, and Fauci making statements that he just wasn't really had much optimism about it being a treatment for severely ill COVID-19 patients. And I didn't blame him, given the type of data and some of the consistent messages that were coming out, albeit the earlier studies were pretty small. So now we're talking about this past week, and look, you wouldn't believe it, but there's sort of grumblings, and apparently more than 140 scientists and physicians challenged the validity of that big Lancet study that really triggered the WHO and in the country of France for stopping using this drug. They challenged the validity based on a few things. They talked about how the researchers failed to account sufficiently for factors that may have influenced the results, including disease severity, because that's something you have to take into account. And even though all of these people were in the hospital, there's different grades of severity. They raised concerns about the lack of ethics review. Every clinical trial and research project in the United States has to be reviewed by an independent panel, an institutional review board, to make sure that certain safety measures, especially for the patient, are met. And they could not definitively claim that this was done for every patient that was enrolled or they had data for in this study. And there were errors in the underlying database that people had concerns about. So the Lancet signed a pledge, the journal, to support data sharing during the corona pandemic, meaning whatever they published, they would eventually make that data available to the worldwide scientific community so that they can build on that and learn even more. Instead of everybody having their own little pieces of information, this is a worldwide effort. And they just couldn't get the data from the original company that did it. They were being unduly secretive about the data sources and methods. And so that caused the big uproar. And so right after that, for some reason, that wasn't clear at this time, but it will be in a second, WHO backtracked and said, well, you know what, we need to resume the hydroxychloroquine trial. And they didn't really say specifically all the reasons, other than that it still really wasn't absolutely clear that hydroxychloroquine did not work in COVID, and that the world needed to know a better answer. And then just a day after that, the Lancet journal retracted the study. The authors all but one, which is the author that was the president of the company that was analyzing and coming up with this information, the analyses. All of the other authors, I guess, were pressured to come up with the answers to what I had mentioned earlier as to where the data came from, to reveal the data to the worldwide scientific community, more about the questions about the ethics. And they decided to just withdraw the study from the journal, meaning, basically my bad, it doesn't count. And they didn't admit anything, but if you read between the lines, I'm guessing that they weren't sure about the accuracy of it, or who knows? The worst thing that could happen is maybe someone just made some of this stuff up. But bottom line is that it's not a valid study in the eyes of the scientific community, and we're still at the point where we don't know whether it works or not. And there's still a lot of studies that are ongoing, and so none of this changes the message that the danger in taking Plaquenil is when you're really sick with COVID-19, and not for the vast, vast, vast majority, the hundreds and millions of people who have been taking Plaquenil for lupus and rheumatoid arthritis as we know it. So don't let that concern you. There's only one question that I'm going to address tonight. The others, by the way, were on general lupus issues. And Terry may reach out to you, send you some, direct you to some general resources. We may get to a point where we have some future virtual halls down the road, where I'm happy to answer some general lupus questions. But the point of this virtual town hall for me, the weekly Sunday night ones, are those questions that are specifically related to COVID. Okay, so keep sending those questions, but we only had one this week, and this question was, should lupus patients decrease the amount of prednisone in case they get COVID? And I don't know if the person who sent this question had come up with this based on some information that had come out this week, but based on some analyses from this Global Rheumatology Alliance, where it's an international effort to find anybody with a rheumatologic condition. So this is not just lupus, but also rheumatoid arthritis, vasculitis, psoriatic arthritis, things that your rheumatologist would treat around the world. And anybody who got COVID or was suspected of having COVID is being encouraged by their physicians to upload information de-identified into this registry. There's also a patient registry where patients themselves can upload information. But there's a European rheumatology meeting that is going on virtually this week, and some of the analyses that came out of this registry, and again, this is not lupus specific, but there were about, I think, a quarter of the patients that had lupus. The good news is that in general, it does not seem that rheumatologic patients in general, there doesn't seem to be a huge increased risk of developing COVID and bad outcomes in COVID. That doesn't mean that there aren't any subtypes or specific groups that we still need to figure out. Specifically, there's a couple that seem, or actually one group that seemed to have had slightly worse outcomes. And those were patients on higher doses of prednisone, meaning 10 milligrams or more. Now, before you go out and start throwing away your prednisone, this gives you an idea of the challenge that we have in analyzing this type of data. People with very severe underlying conditions, bad lupus, bad rheumatoid arthritis, those are conditions where if you got sick with an infection, including COVID, you can do poorly. And we've known about that for a long time. If you have bad underlying disease, having an infection could be worse for you. So somebody who's on higher doses of prednisone is probably taking it more often than not because of bad underlying disease. So is it because this person is having poor outcomes from COVID because of the prednisone, or because the prednisone at the higher doses represents their underlying severe disease that they have? And those are the questions that still are out there. So please, please do not stop your prednisone. Don't overly be concerned about that. Do bring it up with your rheumatologist or your physician next time. Talk it out. And by all means, the last thing you want to do is go down too quickly or God forbid, stop it, and that'll flare your disease like crazy, and that will be just as big of a risk, if not larger, for having poor outcomes if, God forbid, you were to get infected by COVID. So I'm just going to end it here. Just give you a second. By the way, there's CDC has reports of people gargling with bleach, thinking that that'll protect them after being out and about. Please, that is not good. If you know anybody who's doing that, just blow that bubble out of the water. That is not something that's going to work. So keep in mind the lfaga.org website. Keep sending your questions by 2 p.m. on Sunday, info@lfaga.org. And I will pass it on to Representative Kim Schofield, which I'm so thrilled that she's here. So let me get out of my screen.
Well,
you see a share screen button?
I do. Well, good evening, everyone. I'm going to share in a few minutes, but good evening, everybody. Thank you, Dr. Lim, for always providing us with this great information and insight. And thank you so much, Terry, for the invitation to be a part of the lupus family and to educate from a legislative perspective. Thank you to all of my friends and colleagues on the phone. I see your names. I wish I could see those beautiful faces, but I know we'll all be able to see each other and get together hopefully soon. I just want to ask a question, and again, I'm going to use my imagination. Raise your hand if you are sick and tired of coronavirus. Come on, I see everybody's hand going up. I know you're on the phone. I don't see a person, but I see thumbs up. If you are sick of the Rona, raise your hand. It's been a battle. Thank you, Alita. But it's been a battle, and I know we've been through this storm, and we've gone up and down in our numbers, and the data has been hard to read. So once again, I thank you so much, Dr. Lim, for making it easy and readable and understandable for us. So a couple of things that I just wanted to discuss tonight from a legislative perspective, and that's about the Democrats and Republicans. This is very bipartisan, so I'm not political, but I wanted to let you know how we are keeping you informed. And we are doing our best to make sure that we're getting to you information in real time. And on the House Democratic Caucus side, what we do every day at 5 o'clock is we are on Facebook, and we do what we call legislative or press briefings to keep you informed, to tell the truth, to help you understand the platforms of which legislatively, and making sure that you know the difference is between the bills that we're trying to pass, the bills that have been proposed, how this impacts your life. So every day we are on Facebook at 5 o'clock for 15 minutes, giving you an update. The question I'd like to pose to you, everybody on the phone, to think about is ask you, how do you get your daily news? So are you getting your news through the internet, or is it watching the local news, or are you looking at newspapers and it's print media? See, there is such an importance right now of being plugged in. And, we always told as advocate, and as Chris is always told, we do advocacy days so that you are connected with your policymakers and your legislators so that you're in the loop. And more so now than ever, it is really important that you get your information somewhere, but you are connected and plugged in. So if you are not and don't know who your legislator is, you can always go to the website, and we'll put everything in the box, but find my legislator and put your information in. And let me tell you why that's important. It's because, thank you. It's important because you want to be able, if something is wrong, you want to be able to pick up a phone, send an email to one of your legislators, whether it's the House or the Senate, House Rep or Senate, to say, hey, I have this problem. That's what we do. The connection that we've established through the advocacy efforts, but more so the one that needs to continue behind just Lupus Day at the Capitol, plugs you in to get resources. Example, there have been many people that have reached out about what's going on with trying to get Plaquenil. When this whole Plaquenil thing hit, my phone blew up. My emails were coming in. Our lupus community were just scared. And so to be able to plug in, and I was able to get to Dr. Toomey and say, hey, listen, and work with Dr. Lim, and we were able to come up with the messaging, and then we were able to work on an executive order so that it regulated the distribution of Plaquenil. So it's important that you engage and know. You don't know your legislator. You don't have to be a politician. You don't have to be political, but you need to know people. That's a lot of P's. You need to know people, and people that can get things done advocating on your behalf. When there were unemployment issues and the checks and people's checks were getting stalled and they weren't getting they filed the paperwork and the backlog, if you had called your representative, we're able to navigate through a system that could possibly get you some help. So again, reach out to your legislator. Reach out to the people that you've elected to put in place to help you navigate through a system. I see some of you are getting your news on cable TV. Again, get your news some way, but really make sure you're plugged into the local level, because we're the ones that are making decisions real time, and things are moving fast as to what resources that you need, what things are impacting your community. Make sure that you're on your legislator's newsletter. You know, usually most of us do a newsletter, weekly, monthly, whatever, to get you some information. So make sure you're going on their website and signing up for their newsletter. I know Betty is one that is definitely in tune to what the federal Congress people are doing on a federal level. And she kind of feeds me things and will tell me, hey, did you know this about, so, you know, again, and then plug into the advocacy team here. You know, you've got a great leader with Chris and Alita and Betty and all the others that are advocacy champions. Make sure that if you have a question about finding your legislator or being connected, that you're reaching out to them. But as we are preparing to go back in session, the number one priority that we have to do is to finish out the 2021 budget for the state of Georgia. So we're trying to do a balanced budget. And most of you have heard right now, it's no big secret that we're proposing, the governor is proposing 11 to 14% of cuts across the board for agencies. Problematic because the number two agencies that are looking to be hit the hardest are education and healthcare. So give me a thumb down if you don't want us to take any money out of healthcare. I mean, I'm gonna do my own thumbs down. I'm gonna do them so you can see I got both thumbs down. So we have challenges here. We don't want to see anybody else. This healthcare system has problems. Now, one of the things we do know that we've been fighting for years, I've personally been on that battlefield, is for expanding Medicaid. It would not have solved all of the problem of COVID-19, but it sure would have been helpful. So, you know, we know that's not going to happen, but we do know that the cuts that they're looking for in healthcare are not sustainable enough to help those that live with chronic diseases. And for me, personal, you know, it's always personal. If you can't help the lupus population, don't look for me to support a budget. So it's not just that, but it's other factors, but that's the number one thing. So we will be preparing to go back on June 15th. The Capitol will be open, no visitors. The public building is open, but they're really discouraging people to come down there. And I do tell you guys not to come now. Let's see. So that's about just making sure that you're connected, find your legislator, get to them. Also, all of our meetings, our committee meetings are starting this week. You can go online, they're open meetings, they'll be doing them virtually. So plug in, sit into the meetings. If you want to know the cuts in healthcare and what they're doing, you can go to www.legis.ga.gov. And again, I'll put it in the box, in the chat box, Terry will send it out. But you have the right, it's the people's house for a reason, because you are the people. And so I believe in transparency. So I will always, always, always tell you the truth about what's going on. And the reason why I say that is because when we started this advocacy thing, we knew that we were outsiders trying to get as much information on the inside. So now that I'm on the inside and I see the real workings of, partisan and politics, it doesn't work for all, but I'm going to try my best to get it to work for most. So that's what I wanted to say about that. Keep yourself in the loop. The next thing about the opening up of the guidelines. Okay, I'll answer the question in 1 second, Alita. But opening up the guidelines in the state, again, wherever you feel about this, the difficulty was that, we weren't ready. We did not have the CDC guidelines of being COVID viruses being down for 14 days. But Georgia is a pro-business state. So their number one thing is to keep their status of being the best place to do business. That comes with a cost. And the cost is that you made decisions a little bit too quickly to get the population, the business population going, and understandably so, because we're trying to stabilize the economy. That being said, the governor has his guidelines on his executive orders on opening up the state, and those can be found at www.georgia.org. So those guidelines can be found there. It lays out every protocol for going back and opening businesses and what needs to happen. So again, we know that there are people, and we talked on a couple of weeks ago, people that absolutely have to go back to work. And so what I say to you is that to make sure that you are prepared, that you have your own PPE, the protocols for in your office, what documentation needs to go to your HR and to your managers to protect yourself. And I know some of this information is listed on the Lupus Foundation's website under the COVID-19 resources. So make sure you know how to go to work. I understand the fear. I understand the struggle of having to go back out in public. It has created a level of anxiety in myself as a person living with lupus that I never knew I had. So it's a real thing that when you're scared of the unknown and we have these pre-existing conditions and high risk, that it's a challenge to go back to your job and do your job without worrying about if somebody comes, coughs, sneezes, if I touch a doorknob, whatever. Work through that, talk to someone. It's scary. I get that, it's scary, but we have to learn to find a way that's working for us to integrate us back into this social space that we need to do. I was doing something this weekend, my first time being in public, and I was out at a testing site, and all of a sudden, this wave of anxiety when all these cars came to me, I almost ran and jumped in my car and came home because it was dead. But I had to, work through this and remind myself I'm doing the best that I can by masking up, that making sure I'm washing my hands for 20 seconds, making sure that I'm not out for so long and I'm doing social distancing. So knowing that you have to go to work, there is a chart that I've sent out that I will be pulling up, and it's already posted on our website, and I think Terry's website, but we'll send it out again to know what it's like to come back into the workplace. The next thing I do want to pull up my screen is over here. And these are some other resources that, these are my resources. There we go, from the beginning. That I have that are just some government resources for the CDC. There's some Medicaid resources here. I have aging resources. There's a ton of things that are out here. If you needed help with your medications, here's some support here, patient groups. And then I also want to talk a little bit about the testing sites. Coronavirus is not over. And as Dr. Lim has said, we see the numbers over the weekend will decline, but start the first into about Tuesday through Thursday, they start to increase. And that's because of people getting out and we're moving around in our spaces. So please be careful. But there are a number of testing sites that are open should you want to get tested. CVS is doing a lot of minute clinics now. You have all of the testing sites through the Department of Public Health are listed here, and I listed the website on that. This weekend, my concern was making sure that the protesters, the demonstrators, the organizers, the agitators got tested. If you're participating in any of the marches, and thank you for doing that, but I really want to make sure that you stay safe and healthy. And so I set up some testing sites in my area, and on Saturday, we were able to test over 300 people that came through mobile testing. And I'll continue to do them in the south side of Atlanta, Fulton, Clayton, and city of Atlanta for as long as I possibly can. But find a place to get tested. So that is the other thing I wanted to talk. We talked about going back, and then the additional resources that are listed. There are resources to get SNAP benefits if you need help with getting food. There are, you can call the United Way 311, call your local food pantry. There are places, don't sit and suffer in silence. Don't be ashamed and afraid if you're lacking and you can't pay your bills. Most places now are giving some type of, putting a moratorium on evictions, on rents. If you need rental assistance, we have looking at the pandemic resources. If you need rental assistance, please let somebody know. There are banks. Again, I want to stress to you to talk to people. Let them know what's going on and where you need help. While they may not be able to fix it, at least they can document the problems. If you're having a problem with your landlord and paying rent, again, do as much as you can on your end to talk to someone and try to work it out. But if that doesn't work, call your elected official, call your council people, talk to your mayor, talk to your county commissioners, go up to your legislators, and then talk to your congressmen. This is why we're here. Some of the legislation that we are, as House Democrats, have been working on that are coming out, you'll see it in the next couple of weeks, is we have a criminal justice reform package that's going to deal with excessive police force. We have just a lot of things. The healthcare bills. We did have a healthcare bill that put cameras in nursing homes, but it wasn't even given a hearing. So, there are bills that we have that helped and protect some of us during this coronavirus pandemic. So when we send out action alerts for you to make calls, please be mindful. We're doing this in the best interest of all, so that it's helping. Last year, when GCLEA has done the telehealth and telemedicine in rural Georgia, we put up working on bills to expand rural broadband. Again, it wasn't given a hearing. So some of the things we get frustrated for are because they're there. They're just not given the proper attention and a hearing so that they can make it to the floor to be voted by a House or Senate member. So I wanted to put that out there, that we've been working very, very hard. And then the way that you can help us is, we say it all the time, your power is your voice. Your voice is translated through your vote. You have to get out and vote. Voting is not an option. Now, let me say this. We do know that it's going to be tough to vote if you didn't make the early voting, if you didn't get I just got my absentee ballot. I mailed the application in April. I just got it on Friday. So I'm not going to be able to early vote, but I'll have to go to the poll on Tuesday. The lines are going to be long. They're going to be excessively long, but you can't give up. If you want change to happen in healthcare, in housing, in criminal justice reform, and everything, then you have to do your part by voting. Bring an extra chair, bring your water, bring whatever you need to stay in line, don't leave. The other thing we need you to do is to fill out the census. Well, let me go back to, if you don't know your polling location, because those things have changed. The polling location website, and you can either Google find my polling location, or it is actually FLC.COG IS. And I'll put that in because there's so many, I'll put it in the chat box again before I hang up. And making sure that you know where your polling location is. I thought it was the place that I usually go. Tonight when I checked it, it's not. It's another polling location. So please check. Also check your voting status on mvp.ga.gov. Make sure that you are registered to vote. They have you as an active voter. And then while you're home, please make sure you're filling out the census. It takes less than 10 minutes to fill out the census. The questions were very easy. They come in Spanish. They're, it's the website for that is 2020census.gov, 2020census.gov. So now, I hope this was helpful. I know that as we return to General Assembly that my colleagues and I will be fighting for people with lupus, those that have chronic diseases, rare diseases, and any healthcare initiatives. We're fighting so that funding gets cut out of institutions like Emory, Grady. So we're going to continue to be on the battlefield, but I need you to vote. I need you to call your elected officials. I need you to stay plugged in and connected, because together we can move the needle, we can change the narrative, and we can get stuff done. Thank you. Terry, I'll throw it back to you. Okay, I'll throw it back to you.
And
That was great, Kim. Thank you so much.
Yeah. Kim, thank you. And I just want to reiterate to everybody, everything that is on these slides here and all the websites that Kim have referenced, I will have up tomorrow, along with the video from tonight. I'll have that all up on our website, and it'll be at our the coronavirus updates. It's the very first click when you go to lupusga.org. So we'll have all this recording and all the resources up there. So Kim, thank you so much. Sam, thank you so much for your, Dr. Lim, for all of your resources.
I'm looking for, I guess there were some questions in the chat box. That's what I'm trying to find out. Okay. Alita said, this is an election year. Follow your representative on social media and see what issues they're discussing. So please stay engaged, guys. We're not hiding anything from you, but we need you to change your method of how you get your news to make sure it's on a local level. I don't see any other questions in the chat box that need to be answered, but thank you.
Okay. Thank you, Kim. Thank you again. And thank you for this update. Thank you for being here for us, for both of you, Dr. Lim and Representative Kim Schofield. Thank you guys both for being here for the lupus community. And these resources do get updated, and these videos do get posted. Go back to them, reference them, use them to help your family understand what's going on with lupus and COVID. Get involved. I think the biggest take home that I wanted Kim to get across, and I think she did tonight, is vote. Really make your voice heard. Vote and fill out your census form. We can't be represented in our community if they don't know we live in our community. If we don't fill out that census, we're not going to get the proper representation. And if we don't vote, we can't change anything. So those are two ways in a world where you may feel powerless right now, where you can be powerful.
Thank you, Terry.
Any final words?
Don't vote.
Any final words, Kim or Dr. Lim?
No, again, you guys are my community. And so I remain focused on making sure that we have what we need. Your power under that gold dome, I've told you before, has been it's grown over the years. And so if you have that much influence in the space of within your legislators, how much more can you have as an advocate in our community? This is the time where it matters. We don't have the luxury of staying home because the lines are too long at the polls. We, as a legislator, in order for me to help you, you have to help me. And I ask you to help by voting. I ask you to help your community by filling out this census. As you see the protesting going on, people are hurting. And they're hurting not just because of George Floyd, but they're hurting Ahmaud Arbery and the racism. What they're hurting for is that the system has there's been just so many issues in the system for so long that people are grieving, and this is the way some people are expressing their grief. But the good news is that we have power. As you look across this nation and you see the marches and you see the people standing up, you're like, wow, how in the world can this one person who got up that morning, George Floyd, and went to go about his normal business, who lost his life, change the nation? And that's because one person can get stuff done. You're that next person. Collectively, we are a strong voice. But the power right now that you have is through your vote. So thank you for those that have already voted absentee and early voted. Thank you so much for doing that. But you've got to get your family members, your friends, your cousins. Now is the time. Don't complain if you're not willing to do anything. Okay? Yeah, this is my family. I can say that to you. Let's just be in prayer that none of us have a lupus flare that day that we can't get up out the bed. We're going to say, heck to the no, lupus, not today. I got to go vote. Have the fear when you come back after voting, but at least go vote, okay? Again, I ask you, how many of us are sick and tired of being sick and tired with the things in life that we can't change, like lupus? Well, here's one way that you can change to help lupus, help research, help advocacy. You can vote, and we need you to do it. So thank you tonight, family, friends, colleagues. Thank you tonight for staying on the grassroots level, on the battlefield, and for using your voice and yielding your power to say enough is enough. Healthcare system is going to change because of my vote. Healthcare system is going to get better because of my vote. And resources will get stronger because I'm going to use that vote and my voice to advocate for change. I'm done.
Okay, Kim, thank you. I love how you close this out with your passion. You are so passionate, and it's something that we just all need to hear right now. We just need to hear that we can make a difference in our way, but you have to do it. You have to take the step. It's great to listen to you, but we have to take the step. You have to take that next step and vote, fill out that census form, and get involved. Get involved. And I love Alita's suggestion to follow your legislator on social media, comment, send them messages, stay in touch with them. They're great resources. So
if you need something, call them and ask them. That's all I really want to get to you. We're people too. Housing issues, whatever you need, you don't know the power and the resources